Hello, thanks for joining us for the Medication Pass training. Let's go ahead and get started. Here at Kalamazoo Long-Term Care Pharmacy, we are independently owned and operated, located in downtown Kalamazoo, Michigan. And our goal is to be able to help you provide the best care that you can for your patients, residents, and participants. There are several different ways that you can order medications. We can have your facility set up on CycleFill, which is a way of automatically filling those medications that are maintenance and taken every month, as well as in a pill or capsule form. You can fax us original orders or refills. You can also phone in to your designated contact those new orders or refills. Our pharmacy is staffed Monday through Friday from 8 a.m. to 5 p.m. and we have a technician and pharmacist on call at all times. So we are available 365, 24/7. You can also message or electronically request refills through the EMR system if that is something that you're using. Part of the service that we offer to you is medication delivery. Upon arrival, it is very important that the contents of that tote or box is double checked and crossed with the package slip to ensure it matches correctly. Any discrepancies, anything that's missing, should be reported to us immediately so that we can correct that. And then ensure that you are placing those medications in the proper place within your facility, whether that's a med room, a med cart, whatever is designated via your facility's policy. And then both parties are confirming that delivery by the signing of that package slip. We do offer disposal of medications, and this would be non-controlled medications. Due to legal reasons, we are not able to accept controlled medications. That would have to be destroyed on site following the proper policy. So if you do have other medications that are non-controlled that have either been discontinued or a resident has passed away, you are able to return those and we can dispose of those for you. We just ask that you do complete a return medication log. And if you need help finding that, just let us know and ensure that gets sent back with the medication to the pharmacy. Our pharmacy resource handbook is just an overall general encompassing handbook that you are able to reference if you have any kind of generalized questions, such as how to use a specific inhaler, how to administer an eye ointment, an extensive list of do not crush medications. If you have particular questions about the proper timing to administer an insulin or a non-insulin, and many more things. So please don't be afraid to use that handbook. If you don't have one, if you've lost one, if you feel yours is out of date, please contact us and we can get that out to you right away. When it comes to writing orders, it is always best to try to be as clear and precise as possible. So that just means, writing out the word microgram versus using a sig. Avoiding unnecessary decimal points. Adding a decimal point 0 after a 1 can be very misleading and can be easily mistaken for 10 instead of 1. It's also in best practice to include the diagnosis when writing. That the example here is Zyrtec versus Zyprexa. Both ZY in the spelling of the name, both 10 milligrams, and can be very easily misinterpreted depending on handwriting. But if you include congestion, Zyprexa is not used for congestion, so that helps to just add one more step to ensure that the correct thing is written and then dispensed. Proper blister removal. When passing medications, we want to Just make sure that we are following the numeric order of the blister cards. So that means when you're pulling a card out to pass to a resident, you're not passing a medication out of the number 29, and then tomorrow you're going to do it out of the number 15, and then the day after that you're going to do it out of number 7, and then maybe the following day then you'll start doing 1, 2, 3, 4, 5. You just want to ensure that you're going in that numeric order, and this may seem a little silly, but it is just one more step to help ensure that your med cart is in order, that you are on top of your entire process of med passing, so you're not passing out of random bubbles and then potentially miss a medication and think that your blister card is empty and then dispose of it when really the resident may have had 1 or 2 tablets still in there. Some of these tablets can be very small, and they can be very hard to see, especially against the silver foil. So by going 1, 2, 3, 4, 5 in that numeric order until the card is empty is helping you to ensure that you're not missing any medications. And then it's also just keeping your med cart a little more orderly. You want to also make sure that you're removing any of that excess foil or paper behind the blister card. And this, again, may seem silly, but that is just that much more space that's being taken up in your med cart. It makes it that much harder to slide the blister cards in and out if there's all these little tags that the other cards are catching on. So if you can, just take that extra 2-3 seconds to kind of clear out that extra paper, extra foil. Some best practice guidelines. Just ensure that your med cart is being kept neat and clean, that you're not having any beverages or food items that are not related to MedPass on that cart. That includes your morning coffee, candy, any kind of snacks. Just make sure that that is all cleared away. And that's not only for your residents or your protection, but that's also in the event of any kind of a state audit. Those are items that should not be there, and that can be something that that your facility ends up getting dinged for in an audit. Ensure that only authorized staff members have access and have the keys, that we're not just leaving keys hanging up for anybody to access, or that everybody has access to the medication. That's not how it should be. Only the authorized people who have a need to be in that cart should have access to it. You also want to make sure that all the supplies that you need for a MedPass are on that cart. A pill crusher, the souffle cups to administer the pills, oral syringes, different cups to be able to mix applesauce and pudding. Make sure that you are also always checking what PRN medications a patient has and any kind of vitals that need to be done before you do any kind of medication pouring or collecting in a medication pass cup. You're wanting to ensure this before you do all that to make sure that you're not administering medications that don't need to be administered if they don't meet certain vitals beforehand. Here are just a handful of suggested supplies for the med carts. Blood pressure cuff, tissues, souffle cups, pen, spoons, applesauce, pill crusher, paper. If you're using an electronic MARS system, it'll be a laptop to be able to utilize that. If you're using paper MARS, that's going to be a binder with categorized paper MARS. Best practice guidelines for hygiene. Washing your hands. Make sure you're washing your hands correctly for at least 20 seconds prior to the medication pass, in between each resident, as well as after administering any kind of topical or any medications that come in contact with the mucous membranes, and after you remove gloves. Again, make sure that you're washing for at least 20 seconds. And always, always pour the medication into a medication cup. Don't pop pills out of blister packs or comp packs or the automated packaging straight into your hand or straight into the resident's hand. Ensure that it is always going into a medication cup to then be taken. You want to ensure when you are starting your med pass that you are doing everything you can to avoid interruptions. Here's a small study from Sydney, Australia that just essentially points out the implications of each interruption and how that causes an increase in failures and errors. So you're wanting to just ensure that you are taking extra time to avoid any kind of interruptions, any kind of phone calls or being pulled away if at all possible. Timing is very important when it comes to medication passes. Each facility runs a little bit differently. It can be scheduled, in an hourly or an hour block timing. It can be upon rising, prior to bed. So just follow along with however your facility is set up and your facility policies outline. But we're just wanting to make sure that you're staying within 1 hour of that scheduled administration time. You don't want to, give something 3 hours after the person has woken if it's supposed to be upon rising. You want to make sure that that is being done in a very timely manner. Also be very aware of those residents that have mealtime dosing. So that can be before meals, with meals, or after meals. And just ensure that, if Mrs. Jones has to take this medication before she eats, that she's not going to lunch or breakfast, dinner, eating, and then returning before she is receiving that dose. There are several different types of packaging that we do offer here at Kalamazoo Long-Term Care Pharmacy. There is the typical unit dose single blister pack that I'm sure everyone is very familiar with. Our controlled substances are also done in a unit dose blister. However, they are smaller, more compact blister cards to look different. And they also come with a control sheet on every single one. And then there's also a secondary step to ensure the count where we back count our stock bottles after dispensing. We have two different types of automated packaging. One of them is TCGRX, and those are time-blocked individual plastic-y type of bags that contain all medications to be taken within that time frame. There's also what we call a comp pack, which is very similar, and it is both automated as well as manually packed, and it is essentially a larger blister card. The bubble packs are larger and they fit the entirety of the AM, noon, evening, and bedtime in each one, all medications that are taken at that time. And I'll go into each one further as we continue on here. You'll see different color coding on the blister cards. Yellow is for morning, AM, the green is our noon, PM or evening is orange, and then bedtime is blue. You'll see a red PRN sticker, that's for the as needed or PRN medications. And then all of the controlled medications will also have a white sticker, a white oval sticker with a large C for control. So the different type of packaging, we'll go into a little bit more detail here. So this is our blister pack, probably what you're very familiar with. You will see here that control sticker, and then up here in the corner is the indicated time sticker. Um, this particular card is a little bit different looking than our current card. This one on the right looks a little more closely to what we're currently using. So this is what we call our comp packaging. This can be filled either by our automation robot or it can be manually packed by our technicians. And each tab you see here a morning, noon, evening, and then bedtime with a corresponding color code. The day of the week is along the side. And each blister each blister bubble will contain all the medications that are taken in the AM, noon, evening, or night for that day. So then all that has to be done is this little tab pulled back and all medications that are taken at that time can be removed. The comp packs are completed, you typically get 4 to 6 per cycle depending when that cycle starts. So it's adjusted to match the starting day of the week. So your cycle may start on a Wednesday, meaning your first card will have nothing in Sunday, Monday, or Tuesday, and it'll start on Wednesday, continue through the pack, and end on the correct corresponding day. A second form of automated packaging that we have is what we call TCGRX, and these are the individual little plasticky kind of bags I was talking about. They can be separated in time of day for dispensing, such as morning and bedtime, or it can be packaged up in a continuous fashion, such as there will be a morning packet, and then perforation noon packet, and then another perforation, and then evening, another perforation bedtime, and it would come out in that order. This is very good for giving out medication to those residents that may be going away from the facility for a vacation or respite, anything like that, or just going away for the day with family, to be able to give them their doses and properly marked doses to give to that resident or their family member. Just some further pictures of that packaging and what's included on there. It includes the medication, patient name, date, time of administration. We have in the past received questions regarding to sending just a standard label for the patient for items such as OTC or an item that we did not send. So I just want to take this time to say that we cannot send just a label to the facility. Label laws require us to put the label on the medication that we dispense. So even if the doctor has written for a prescription for Miralax or Docusate or 81 milligram aspirin, and the resident's family member decides to go to Costco or Sam's and buy a bulk amount of that, we still cannot send a label even if the doctor wrote the prescription, because we need to be the ones dispensing that if we're giving out a label. If you have any further questions or issues with this, please don't hesitate to reach out and we can discuss that further for you. Just a quick touch on HIPAA compliance as far as MedPass goes. You want to ensure that you're covering any kind of confidential information, whether that's a binder, if you're using paper MARs, if you're using an EMAR system utilizing their privacy safety feature that covers the screen. And then also just use caution when you're speaking. Don't yell down the hallway that Mrs. Smith needs her Imodium again today. Anything like that. Just less is more, and ensure that you're using all caution that you can. Even if you don't think anybody's going to walk by, if anybody's going to look or see anything, or if you feel that, oh, the only people here is everybody that already knows, what Mrs. Smith is on. That doesn't constitute being able to just leave it out in the open. Still ensure that you're covering up anything confidential. There are 6 rights for medication administration. That's the right to having the right drug, the right resident, the right dose, the right time, the right route, and the right documentation. And just ensure that you are single, double, triple checking everything. There are specific routes for the different administration of medications. There's tablets, capsules, liquids, oral inhalers, nasal sprays, nasal inhalers, ophthalmic, otic, vaginal, rectal, injection. So just ensure that you are choosing the correct administration. In regards to safety and security, always ensure that you are locking your med cart. Even if you feel you're just going to be away for a moment, if you're in the middle of med pass and you're going to be going back and forth and back and forth, ensure that you're still locking it. You don't have complete control over the people that walk by, the intentions of those people that walk by, so just ensure that it is always locked when you are not in it and actively using it. Don't leave any kind of medications on top of that med cart, and then always make sure that you're checking expiration dates. All blister cards are written with an expiration date of 1 year from the date of package, unless that medication bottle has a sooner expiration date. So just ensure that you're always staying on top of the expiration dates of all the medications in your cart. Make sure that you're monitoring the medication pass. So when you give Mr. or Mrs. Jones their medication, that you're observing them swallow that medication. You are observing any kind of therapeutic or side effects. And then know that that patient does have the right to refuse their medication. It's just our job as med passers to offer that medication. If they refuse it, you're going to educate them on why it's best for them to take that and why the doctor's prescribed it within your competency and within your right of practice, and then re-offer that medication to them. If they still refuse, document that effort, and then you're going to continue that cycle again when it comes time to pass that medication at the next time slot. Going back to kind of hygiene, and never touch the tablet or capsules with your fingers. If you have any kind of hazardous medication, such as finasteride, methotrexate, misoprostol, that you're handling that medication appropriately. And if it's a medication that pregnant women should not handle, that you're ensuring you get a non-pregnant member of the facility to help you pass that medication. Be very aware of the do not crush list. There are many medications that should not be crushed. So this can be in reference back to the pharmacy resource handbook that we have. And if you have any questions as to whether or not a medication should be crushed, give us a call. Let us know, and our pharmacist can talk you through that. If the doctor has written a medication for a patient that is a crush only patient, and that medication is on the do not crush list, we can look for alternate routes, alternate forms that comes in, and if that's not available, then we can talk with the doctor and see the best way to move forward. So please don't ever hesitate to contact us or the physician. So moving right along with tablets and capsules, if your resident is not able to swallow a prescribed tablet or capsule, please contact our pharmacy and we can see what other options there are to be able to administer that to the resident. You can crush a tablet using 3 souffle cups, placing 2 cups stacked together, the medication, and then 1 cup on top, and crushing it that way. And make sure that when you are mixing that crushed medication with applesauce or pudding, that you're placing that food in the cup first and then the medication on top. When a resident has a medication that is only given under certain parameters, make sure that those parameters are being met before you combine all the medications and crush them together. That can just lead to unnecessary waste of the medication if the patient didn't actually need that blood pressure medication, or just a medication that the doctor would like to see X before giving the medication. Residents should not swallow anything that is marked as sublingual or buccal. If it's sublingual, it should be placed and held under the tongue, as well as buccal should be placed in the cheek pocket in the resident's mouth to allow for it to dissolve. Make sure that all powder is removed from the cup after you've crushed it, or the plastic pouch from the Silent Night tablet crusher. And then when you're administering crushed medications and liquids, just be aware that they may not always taste the best. So just be a little more sensitive to the fact that the resident may not want to take it, and you may have a higher refusal rate. So be aware of how to handle that. And if you run into any issues, don't hesitate to contact us, the physician, your clinical staff at the facility there. There are different types of liquids. There are suspensions, there are solutions. Suspensions are medications that are, as it suggests, suspended in an oral solution. Solutions are medications that have dissolved into the solution and become a part of it. If the dose cannot be precisely measured with just a simple cup, ensure that you're using an oral syringe, or if you have another type of device that's able to accurately measure those. With all of our liquids, we provide an oral syringe to be able to help you in that accurate dosing. If you're pouring medication out of the bottle into a cup, ensure that you're pouring it away from the label. So you're pouring it down from the back side of the bottle. That just helps in the event any kind of dribbling, dropping of the liquid doesn't interfere or mess with the label. If you pour too much liquid into that cup, don't ever pour it back into the bottle. You'll just have to waste it and pour out that extra into your designated access location. Ensure that you are rinsing the medication cup with a little bit of water or juice, and then having the patient take the rest of that liquid from the cup. And this is just to ensure that that resident is receiving the entirety of that medication dose and none is stuck to the side of that cup. With insulin administration, you want to ensure that you are properly storing those pens and vials according to the recommendations. It used to be common practice that the expiration date after an open vial or pen was 28 days, but that is not necessarily the case anymore. With all of the new insulins and non-insulins to the market, just ensure that you are properly storing those. Make sure that when it comes time to administer those insulins and non-insulins that you are doing that at the appropriate time in regards to meal time, so before meals, during meals, after meals. If it is within your facility's policies that you're taking that med cart to the room, make sure that you're preparing and administering just one dose at a time. And whether that's one dose for that patient that may have multiple, or if that's all of your patients with diabetes, that you're not preparing all of them across the board. You're just doing one at a time. If you have an insulin that is mixed, such as a Novolin 7030, a Novolog 7030, that you are gently mixing that insulin by rolling it And also ensure that you are properly disposing of those sharps, so the syringes or the pen tips. If you are in need of a sharps container, please give us a call and we can get that out to you right away. There are multiple injection site locations, so that can be the abdomen, the outer area of the upper arm, the front and side of the upper thighs, and the buttocks. Just make sure that you are always rotating those injection sites. You're not injecting in the same location every time. And be aware of the different absorption rates for those different locations. With the abdomen having the highest absorption rate and the buttocks having the lowest absorption rate of those sites. So just a little quiz. Is insulin given via intramuscular injection? Nope, it is sub-Q or subcutaneous. It is important to rotate injection sites and document. Yes. As a time management measure, it is appropriate to prepare and administer insulin injections to several residents. No. Topical medications. As with all medication paths, ensure that you are washing your hands for at least 20 seconds and wearing gloves. You're going to position and drape the patient. You want to ensure that you're inspecting the skin and cleansing that affected area. Pat it dry or allow it to air dry, depending on the assessment. If you have a lotion, ensure that you're shaking it to properly mix. And then cover the skin with dressing if it is ordered by the physician after you've placed it. After you have placed that topical medication and the dressing if appropriate, reposition the patient and cover them. You're going to dispose of any soiled supplies, and then ensure that you are again washing your hands for at least 20 seconds. You're going to properly document that dose as well as the site that that dose was applied to. When administering transdermal patches, you want to ensure that you're checking for any old patches from the prior dose on the patient and making sure that you are removing that before placing a new one. You want to check the skin for any sign of irritation from that prior patch. If there is, ensure that you are reporting that to the proper person according to your facility's policy. That can be the pharmacy, that can be the physician, or your clinical team as indicated. If it is your facility's policy to mark that patch, ensure that you do that before you apply it to the resident's skin. If applicable and if needed, remove any hair from the area where the patch will be placed. Ensure that you're holding that patch in place for 30 seconds. You just want to ensure that that adhesive is properly in contact with the skin to ensure a proper hold. If needed, you can place tape around the edges if that patch begins to pull up before it's time to replace it. Ensure that you are washing your hands, again, after the application for at least 20 seconds. And if you have a patch that you feel needs to be cut, please give us a call first before you cut that patch to ensure that it's one that can be cut. Moving on to metered dose inhalers, you want to make sure you're washing your hands for at least 20 seconds. And then you're going to explain all of the steps to using this inhaler to your resident. So make sure that you have the unit assembled after inspecting the mouthpiece. You're going to shake that medication canister inside the mouthpiece and then have that resident exhale fully. And then they're going to place the mouthpiece either in front of their mouth or in their mouth with their lips wrapped around. However, it is designated in the manufacturer's recommendations. And then while inhaling again slowly and deeply through their mouth, you're going to depress that canister fully. Have the resident hold their breath for 10 seconds or as long as possible. And then exhale slowly through pursed lips. And the point of pursing the lips is to ensure it is a slow, controlled exhale. Here is a pictogram to be able to just give you a better idea of the timing and how that works. So the top picture being with a spacer and the bottom being without a spacer. For a discus, it is slightly different. There's no shaking of the item, as well as it is kept parallel to the ground. It doesn't have a separate canister and mouthpiece. You still want to inspect that mouthpiece and ensure nothing's cracked or that nothing has gone inside of it. But it's not a separate item like the meteor dose inhaler is. But it's administered in the same way in the sense that the resident is going to breathe out, breathe in deeply through the inhaler, hold their breath, and then slowly breathe out through pursed lips. If you have a resident that is using the Spiriva HandyHaler, you're going to make sure that you're wearing gloves because you will be touching the medication. Open it up from the foil packet that the pill is in. And a side note, this pill is only to be used inside of the HandyHaler device. You are not to have the resident swallow the capsule. So moving forward, you're going to place that pill inside of the HandyHaler, pierce it. So that's going to be done by the second image, which is pushing the side button. That's going to pierce the capsule. And then the resident is going to place the mouthpiece on their lips, breathe in, and then exhale, and then they're going to breathe in again. Do not have them exhale into the device. Make sure that they're removing it from their mouth before they exhale to inhale a second time. And by inhaling that second time, you're just ensuring that all of the contents of that capsule have been inhaled properly. For oral inhalers as a whole, you want to make sure that you're waiting 1 full minute between puffs of the same medication. If you have different medications, such as that albuterol meteor dose inhaler and a corticosteroid inhaler such as Advair, you want to wait 5 minutes between doses. So you're also going to use sequential inhalers in accordance with the doctor's orders. And you always want to make sure that you're using a bronchodilator before any steroids or other type of inhalers, if there are more than one type for that particular resident. If a corticosteroid is used, make sure that that resident is rinsing out their mouth to avoid any possibility of thrush. A nebulizer is another way to administer inhaled medications. This is done by a nebulizer machine that vaporizes the medication for that resident to inhale over a longer period of time. If at all possible, these should be done in private within the resident's room. Make sure that you are measuring the correct amount of medication and putting that into the medication cup. Typically, it is just one entire ampule or little plastic vial that this medication comes in. However, ensure that you're reading the directions on that prescription label from the doctor in the event you need to either mix that with another medication or if you need to dilute it, that you have that correct medication. You're going to connect all of the pieces, so that's going to be the tubing into the bottom of the medication cup and connecting that to the nebulizer machine. and then connecting the mouthpiece or the mask on top of the medication cup. You're going to either put that mask around the patient's nose and mouth, or you're going to instruct them to place the mouthpiece in their mouth with their lips around it. And then they're going to just take slow, deep breaths in and through their mouth. Continue to observe that resident. It'll take about 15 minutes before all of the medication is gone from that medication cup. Once it's done, have the resident rinse their mouth and then rinse the equipment. Recommended cleaning is that you soak the parts for 1 hour in a solution of equal parts vinegar and warm water weekly, and then rinse it well and allow it to air dry. So a little quiz of oral inhalations. Steroid inhalants should follow bronchodilators. That is true. Inhalants of different medications must be given at least 5 minutes apart. And it is important to rinse the mouth after use of steroids or corticosteroids to prevent thrush. Moving on to eye drops, they are of particular concern when it comes to storing them. You want to ensure that they are stored separately from regular medication as well as separate from eardrops. You're going to ensure that you have washed your hands for at least 20 seconds, both immediately before and immediately after administration. The abbreviations for both eyes, right eye and left eye, are provided here. We have both eyes as OU, right eye OD, and left eye OS. The pharmacy label should have the location spelled out. It should not be abbreviated. So if you notice on your label it is abbreviated, please let us know and we'll get that corrected right away. When administering eye drops, ensure that you're giving any kind of dilators first, and then you'll give the steroids, and then any kind of lubricants if it is applicable for that resident. Then when administering those different types of medications, ensure that you're waiting 5 minutes between the different types. So 5 minutes between the dilators, 5 minutes between the steroids, and 5 minutes between the lubricants. If you have multiple drops of the same medication, you're going to just wait 3 minutes between each one. Avoid touching the tip of the dropper to the mucous membrane. If you have touched it, you're going to want to replace that medication because it has then been contaminated. And see any kind of policies that your facility might have as far as the administration and any kind of infection control when it comes to eye drops. If you have a suspension, then you're going to want to make sure that you shake it well or even just roll it between your hands to mix that medication. After you've administered the eye drops, you're going to hold the lacrimal duct, which is just the tear duct in the inside corner of the eye, for 1 minute, and this is going to prevent any loss of medication through that tear duct. And here is a picture administration of administering eye drops. Eye ointments. These are always administered after eye drops. And if you need to steady your hand when placing the ribbon of ointment in the resident's under eye, you're going to just rest against the resident's forehead. It's a very similar procedure to eye drops, just instead of placing a drop, you're going to be placing a ribbon along the inside pocket of the bottom of the eye. Do not place the ointment directly on the cornea or directly on the eyes or eyelashes. An ophthalmic test, should they be stored together along with otic solutions? No, they should not. Should the eye drops be placed directly on the cornea? No, again, they should not. If you have 2 eye drops of the same medication, they should be given at least 3 minutes apart. Moving on to the ear. So ear drops, commonly used to treat infection, there's inflammation and discomfort, or to soften earwax. They should be administered at room temperature. If they're too hot or if they're too cold, then it could cause vertigo in your resident. They should be sterile in the event the resident has a eardrum perforation, because there are only a few medications that are indicated for that. So if that's what your patient has, just ensure that you're following the instructions from the doctor as well as those instructions that are on the pharmacy label. Ensure you're washing your hands both before and after the administration of eardrops. So when it comes time to actually administer it, you're going to position the resident on their side with the affected ear facing up. If there is earwax on the outer ear, just gently wipe away that excess. You're going to straighten their ear canal, and that's done by pulling up the back of the ear, or even the tragus portion of the ear until you're able to see straight into it. And then you're going to instill the number of drops that have been ordered. The resident should stay on their side for 5 minutes, and if the doctor has ordered, you can then loosely tuck a cotton ball into the opening of the ear. This should only stay in place for about 15 minutes, and then you can remove it. You're going to then wash your hands between caring for both ears if both ears require eardrops, and then again washing your hands at the completion of the administration. Here is just a picture demonstration. Nasal medications, these can be administered via drops, spray, or aerosols. There are several different types. You can have the vasoconstrictors for nasal congestion, you can have the anesthetics for discomfort, and corticosteroids for inflammation. When administering nose drops, you're going to place the resident in a supine position and instruct them to breathe through their mouth. You're going to push the tip of their nose up and then position the dropper above the nostril, directing the tip toward the midline of the nose. You're going to count the drops as you administer them, and then keep their head back for 5 minutes. And then afterward, you're going to clean and flush out that dropper and then wash your hands. For nasal sprays, the resident will sit upright and tilt their head back slightly. You're going to occlude one nostril with your finger, so you're going to push one nostril shut. And then the open nostril, you're going to insert the tip into the open. You're going to ask the resident to inhale while squeezing the autonomizer, and then repeat as ordered, either repeating in that nostril or switching nostrils, whichever is instructed on the prescription label. You're going to wash the autonomizer tip, and then you're going to wash your hands. For nasal aerosols, you want to shake that aerosol before using it, sit the resident upright and tilt their head back, occlude one nostril with your finger, and then insert the adapter tip into one nostril opening. Press the adapter and cartridge to discharge the medication. Wash the adapter and then wash your hands. Rectal medications, you want to ensure that you wash your hands beforehand and that you are wearing gloves. You're going to direct the resident to assume a side-laying position, also known as the Sims position, with their upper leg flexed upward. You're then going to drape the resident, remove the suppository from the foil or plastic wrapper, and coat the rounded end with a lubricant. Have the resident take slow, deep breaths through their mouth to relax their anal sphincter. Retract the buttocks with the non-dominant hand, and with a gloved index finger, gently insert that suppository approximately 3 inches into the adult resident. You're going to withdraw the finger and wipe the anal area. Discard the glove according to facility policy. Have that resident remain flat or on their side for 5 minutes. If medication is a laxative, then you're going to encourage that resident to retain it for 20 minutes if possible, and that will allow for maximum effectiveness. And then wash your hands. Vaginal medications. These can be either a suppository or you can have creams and gels. So for a suppository, you're going to wash and glove your hands and then remove that suppository and lubricate the tip of it. Insert the suppository with your forefinger and direct the suppository toward the spine and then toward the cervix. Provide that resident with a sanitary napkin and wash your hands. For creams or gels, you're going to squeeze the tube to fill the applicator according to the manufacturer. Insert that applicator, much like the suppository, in toward the spine and then toward the cervix. You're going to wash the applicator with warm soapy water if it's reusable. If it's not reusable, then dispose of properly. Still provide that resident with a sanitary napkin and wash your hands. And with the vaginal medications, that resident, if they are able to, they can always elect to insert that medication herself. The administration of epinephrine or an EpiPen, you're going to grasp the unit with the orange tip pointing downward, form a fist around the unit, again with the orange tip pointing down. With your other hand, pull off the blue safety release, and then hold the orange tip near the outer thigh. This is not to ever be injected into the buttocks. You're going to firmly push into the outer thigh until it clicks so that the unit is perpendicular, so that'll be at a 90-degree angle to the thigh. Hold it firmly against the thigh for 10 seconds to ensure that all of the drug is delivered. You're going to then remove it from the thigh. The orange needle cover will extend and that will cover the needle. And then massage the injection site area for 10 seconds. You're going to call 911 and still seek immediate medical attention. Just because you gave an EpiPen or an epinephrine injection does not mean that everything is okay. You still need to call 911 and seek immediate medical attention. When you get to the emergency room, ensure that that auto-injector that you used is taken with. And just a question on when do you give an epinephrine shot? You give an epinephrine shot when a resident is having a severe allergic reaction. The administration of the Risperdal Consta is quite different than other injectable medications. So in order to provide you with the best training for that, I'm not going to explain that over this slide. Please feel free to give our pharmacy a call and a pharmacist can walk you through that while you have the actual product in your hand. And if you need any further instruction, then we'd be happy to orchestrate that. Similar with the B12 injection, I'm going to advise you to contact our pharmacist and speak with them for a better instruction on how to properly administer a B12 injection. So when it comes to documentation, you want to ensure that you are documenting your med pass before you move on to the next resident. Do not attempt to pass all your residents' medication and then go back and try to remember everything and document it all. If you have missed doses and you have a paper MAR, you're going to initial and circle that MAR for the missed dose. You're going to note the reason on the back of that paper MAR. If you have an EMAR system, then you're going to properly notate that on that dose that it was missed, as well as the reason. If there's a discontinued medication and you're using a paper MAR, you're going to highlight the entry and then write DC'd on that particular location of the paper MAR. If an item is DC'd, ensure that you have a written order from the physician sent to us at the pharmacy so that we can properly discontinue that and ensure that you do not receive that when the patient shouldn't even be taking it. For PRN medications, you're going to properly document that on the MAR, whether paper or electronic. You're going to sign it for paper, date, time, and then why it was used, and then also document the effectiveness of that medication on the reason for that resident taking it. And that'll be done on both paper MARs and EMAR. Documentation for controlled substances is a little bit more involved. You're still ensuring that you're documenting in the paper MAR or the EMAR system, but there is a controlled substance accountability form, also called the control sheet, that is tied to each prescription. And then that documents the doses given as well as how many doses are left of that controlled substance. And then there is a controlled substance count verification form, and that is for reconciling the counts in between each shift. And then this is done at each shift change. If there are any discrepancies, that must be reported to your DON or your supervisor immediately so it can be investigated and corrected. Here is a example of what a paper MAR or medication administration record looks like. It will show the name of the medication, the directions, the times when those are supposed to be administered, and then as long as it is available in our system, it will also have an image of the medication. This is what the PRN medication MAR looks like. The back of the MAR. So this is where you would indicate why you were giving a PRN medication, and then the result or the effectiveness of it. On that MAR, you'll see different site codes. So here's just a general overview of them. This is what our controlled substance accountability form looks like, and this is what will be included with each medication that is a controlled substance. This is the count verification form for what is utilized between each shift. And then some common scheduled medications. So you have your Schedule 2, 3, 4, and 5. The Schedule 5 being Lamodal, the diphenyloxate, Schedule 3, Marinol, Schedule 4, the Xanax, Klonopin, Valium, Tramadol. Schedule 2 is your Demerol, methadone, morphine, oxycodone, Vicodin. The secret to medication safety is to always read. Read the resident's name, read all of the directions on the MAR, read the prescription label, read the unit dose label, and to read any auxiliary labels that may be there. If you have any problems, if you have any questions, please do not hesitate to give us a call. Here are our phone numbers, as I'm sure you'll have them in various locations across your facility. You can always call us, you can always send us a fax, you can call your main point of contact. Our 24-hour on-call phone number is also provided here. You can visit our website. You can always send either Beth or Eric an email, or you can, again, send your point of contact an email as well. We're always here, so please don't hesitate to ask any questions. or ask for any kind of clarification of anything. So I hope that this has provided you with a little bit more information as to the proper way to pass medication at your facility. If you do have any questions, if you're not able to fully remember everything that I've gone over, please don't hesitate to check your pharmacy resource handbook, reach out to us here at the pharmacy, ask any superiors at your facility. Just please, if you have questions, ask. It's always better to ask a question than to assume what you might have to do and do it incorrectly. So thanks so much for taking the time to review this, and have a great day.